committee members. Really appreciate your holding this hearing to look at some of the really important legislation coming before this committee, including the EHR Program Reset Act, which we introduced earlier this year with Senator Brown. I, as you know, have been raising concerns about VA's implementation of EHR from the start. And when I say start, I mean before the ink was even dry and the contract between Oracle Center and the Trump administration was signed. And the criteria for success is pretty straightforward to me. Does it work for our providers? Does it work for our patients? Are we helping veterans get the care that they deserve? Which is what I'm focused on when I talk to our veterans back in Spokane and Walla Walla. Unfortunately, it was pretty clear early on that this new system was missing that mark in a lot of ways, whether it's the providers in Spokane who are really burnt out just trying to navigate the broken interface, or the patients who are unable to get the medicine they rely on because of the system malfunctions. And as we all know, a flawed system can be fatal, and I have previously discussed here about a constituent of mine who received a late cancer diagnosis because the system didn't work the way it was supposed to. So it is painfully, devastating clear to me this system has been not working for our veterans or our providers and was broken. So the reset VA announced this year was really badly needed, but we do need more than a reset. We need reforms that make sure the problems with the EHR are not just fixed, but don't ever happen again in the future. Many of those problems stem from the deeply flawed single source contract the Trump administration agreed to back in 2018. I think we should all agree on that. And regardless, we should be doing everything we possibly can to make sure we have a VA where veterans can get the highest quality of care they deserve. So I look forward to our witnesses and appreciate all of you being here. And let me just start for the whole panel and ask you, what gaps do you see in VA's current contracting process, and what else can VA be doing to make sure that in the future it does not face the same issues that we had with this contract?
You get to go first, John.
Yeah.
Thank you, Senator. A great question, and obviously the EHR, we also resonate your concern. DAV is quite concerned with the progress where EHR was and the safety issues that were brought up. With regards to the contract, DAV's position is that we feel very strongly that our veterans deserve a modernization to ensure that they have the resources that are there to apply quality health issues and needs. But at the same time, we want to ensure the providers have that infrastructure that works for them to provide safe care. With regards to now the contract, DAV does not have a position where we care who has that contract as long as the contract and the VA's relationship of governance over that contract has the authority to ensure that they're doing it right and that they're overseeing with good, strong oversight to ensure VA is held accountable, and so is the contract being accountable to fulfilling the contract and its obligations to the veterans, taxpayers, and this nation. So that's where we're sitting at this time, is we just want to ensure that VA knows what they're doing and does it with the right partners that will get it done for them.
Ms. Thomas, Mr. Lorraine, do you have any comments about the contracting process?
Good afternoon. At this time, I do not have any comments in regards to the contracting.
Mr. Lorraine?
Yes, ma'am. In terms of the contracting, I don't have comments, but I would echo what DAV is saying, that it's critical that we have to get it done. I served on a senior oversight committee at the Department of Defense back in 2008, and this was an issue then. It was in 2008, and it needs to get done. I'm a victim of it myself, and it needs to get fixed.
Okay, thank you. And let me quickly ask about the Expanding Veterans Options for Long-Term Care Act. Our population of veterans is aging, and we have to make sure that there are long-term care options available for them. So that's exactly why I joined Chair Tester and Ranking Member Moran in introducing the bipartisan Expanding Veterans Options for Long-Term Care Act, creating a pilot program for our veterans to get assisted living care. Just real quickly, any of you, can you talk a little bit about what some of our veterans are facing in our rural areas in terms of long-term care? Ms. Thomas?
Thank you for that question. So when we're dealing with long-term care options, especially in the rural area, we already have limited access to care. We actually see this program, this pilot, as a good opportunity to provide the care that, it's like that middle care. They're not sick enough for nursing home care, and they're not able to be on their own. I believe this opportunity for assisted living in rural areas would actually allow for the veterans to get the care they need without having to worry about the financial burden. And I think that's one of the biggest factors that we need to look at.
Okay. The chairman's been generous allowing me to speak, and I'm out of time, but if any of you could give me written comments back, I would really appreciate it. Thank you.
Thank you, Senator Murray. Senator Moran.
Chairman, thank you.